What is the post-operative period like after a facelift? Today, I'm going to talk to you about the 10 main questions my patients have after undergoing this procedure. I'm Dr. Hani Favarin, plastic surgeon, and this is our Monday live session. I usually spend a lot of time during my consultations explaining to patients what it's like, how it works, what to expect, and how to prepare, right? Both psychologically and regarding rest from work, the amount of time off. And today I'm going to share a bit of that with you about the main guidelines I give my patients during this post-operative period. So basically, there are 10 things I advise them about. And the first is swelling, right? Like any plastic surgery, a facelift causes swelling. There will be some, especially in this area near the eyes. Regardless of whether the patient had the mid-face done or the forehead, there will always be some swelling. And since the eyelids are the areas of the face with the thinnest skin, the swelling ends up being a bit more visible in that region. Swelling after a facelift has a timeline of progression. So, as a rule, the patient tends to have a bit more swelling in the first 2 days after surgery. This swelling will remain stable, right, between the second and fifth day, so it won't get worse or better during that time. And from the seventh day on, it starts to go down, and patients start to feel happy, start to like what they see. After the 10th day, it gets much better. And after 14 days, most patients already feel comfortable socializing, leaving the house, and going back to work. So, that period between the first and second week is when patients really start to lose the swelling and begin to notice some of the results. The swelling from the lift usually goes down in a centripetal way. So, it goes down first in the middle area of the face, and the closer it is to the incision, the longer it takes for the swelling to subside. But eventually, after some time, all the swelling goes down and everything returns to normal. This is part of the postoperative process. Patients who have products, injectables in the face like fillers and hyaluronic acid, tend to have more prolonged swelling. And this swelling, sometimes it can be a bit more pronounced at first, exactly because, well, the trauma from the surgery itself can cause these products to reactivate. They are generally hydrophilic, and the patient tends to have a bit more swelling. Here at the clinic, I really like using hyperbaric chamber sessions for the postoperative period. For those patients who have injectables in their face, patients who undergo full face surgery, who operate on all areas of the face in a single surgery, I really believe that the hyperbaric chamber can, help control some of that postoperative swelling. It helps the patient, improves tissue vascularization, helps reabsorb bruises, and enhances the vitality of the tissues. So I really like this treatment, in the postoperative period, especially for this specific group of patients. Also, patients who have had a secondary facelift, right? Patients who are having surgery for the second time, smokers, patients who have hypothyroidism, who are also patients that tend to swell more after surgery. I really like the hyperbaric chamber for them. So you can see that swelling is a topic in the postoperative period that I spend a lot of time explaining to my patients. And as a rule, it tends to follow this timeline of improvement. After 30 days, patients are already much more back to normal. The swelling is much less, and they pretty much return to normal life. Second point, the patient will feel as if her face is a bit stiff. This happens because we place the stitches, in the deeper layers. We work at the level of the SMAS, at the muscle level, and that's why patients feel like everything is kind of tight. So if they try to close their eyes really hard, it feels like there's a pulling sensation. If they try to clench their jaw to eat, it feels like something is pulling. If they try to turn their neck too much to one side or the other, it's the same thing. I usually say that you shouldn't. Well, play tug of war with my surgical stitches during the postoperative period. You should make smoother movements, avoid sleeping on your side, and eat softer foods during this postoperative period, foods that aren't too hard or too hot, precisely to give things time to settle and return to normal. This pulling sensation, it gets better as the weeks go by. And it happens exactly because of the stitches in the deeper layer. Third point, hardening. It's normal. As the swelling goes down, patients start to feel areas of hardness on their face. This happens because the tissues are healing, and every time they heal, they create a certain degree of fibrosis, which causes the sensation of hardening. Usually, it is more noticeable in the neck area, and it lasts longer the more I work on the deeper layers of the face. So, for example, patients who have part of the submandibular gland removed experience this sensation of hardness in the neck for a longer and more pronounced period. Eventually, everything gets better. Everything returns to normal. But there are some types of approaches that really make this hardening last longer and become more noticeable. Fourth detail, patients have difficulty moving their mouths. This happens for several reasons, right? Because of swelling, fat grafting, the pulling of the deeper layer, and even due to the treatment itself that we do in the skin region, the patient may end up with somewhat reduced facial movements, especially in the lips. This also improves as the days go by. The patient doesn't need to worry. It will get better and it will pass. It's just a matter of having a little patience. Fifth detail, asymmetries. It's normal for patients to notice small asymmetries in the face. I was talking about this today with a patient who came in for a facelift consultation. Swelling happens, and it's due to the swelling itself. The swelling won't go down symmetrically. Sometimes the patient gets a bit more bruised on one side. She turns her head a little, or she chews more on one side of her mouth. And because of these little details, she might have a bit more swelling on one side than the other. And this gradually returns to normal, slowly, as the weeks go by. So, what should patients expect, right? All of us have asymmetries in our faces. Yeah, I explained this to this patient during the consultation that usually before surgery, most of us look and don't notice these asymmetries. However, after we operate, we remove, that aging effect, and then patients start to notice these small differences from one side of the face to the other. Most asymmetries have a bony origin. So it's not a surgery that we do on a more superficial area or on soft tissues that's going to correct everything 100%. Of course, we always try to soften these asymmetries that people have, but small asymmetries that the patient already has and that are present before the surgical procedure may remain. They will persist, and the patient might eventually notice them. These aren't things that just appeared, right? But they already existed. It's just that now they've become more noticeable, either because the patient is paying closer attention or because we removed that excess skin, that extra volume that was, in quotes, hiding it. Sixth detail, changes in sensitivity. That's normal, right? We do skin detachment, and it's normal for sensitivity to be altered for a certain period. That's actually one of the reasons why we tell patients to be very careful when applying ice. I recommend applying ice after all eyelid, neck, and mid-face surgeries, always protecting the skin with some kind of cloth or compress. The important thing is that the area gets cooled, but that the ice, the cold, doesn't come into direct contact with the skin. Because since the patient can't really feel properly, right, their sensitivity isn't 100% normal, they could get burns from the cold itself. So that's also really important. Nodules. It's important to know that when you run your hand over the operated area, as the weeks go by, you might feel small nodules. This could be an area where a stitch was placed, it could be a knot from a surgical thread, or it could be due to swelling or the healing process itself. You just have to wait for time to pass. And whenever you feel like giving yourself a massage, first ask if it's okay to do it yet. There are nodules that will appear simply because the suture thread hasn't been absorbed yet, and at that moment, it's actually not ideal for it to disappear or be absorbed. So you have to wait, right? Like I said before, wait for time to pass so that it gets better on its own. Small bruised areas can happen. There aren't actual hematomas, which are those accumulations of blood, but small bruised areas can appear. We use needles to administer anesthesia. We might use nanofat, and every time we pierce the skin with a needle, there can be small, purplish spots, but the patient won't have hematomas. This is another very important point. Even male patients who have beards and undergo surgery in the beard area, they don't get hematomas because of the facial lifting surgery. Incisions. So that's normal. I usually tell my patients that, and it might sound redundant, but we are surgeons, we operate with a scalpel, so we are going to make cuts. Somewhere you're going to have an incision. Then you have to, once again, be patient and wait for the scars to gradually improve. They will fade over time. They'll lighten and heal. Some patients heal so well that these scars become practically unnoticeable, right? I usually explain that generally the scar on the lower eyelid and the preauricular scar are the first to disappear. Usually after about 30 days, they already start to look much better. The one on the upper eyelid and the one behind the ear take a little longer to reach that same quality of healing. After about 6 months, they are practically flat. They end up looking like a little line, really, it looks like a scratch on the skin. Sometimes, even I have trouble finding these incisions in my patients who are further along in their post-op recovery. I don't know if anyone out there is thinking about having one of these surgeries, right? Like blepharoplasty or a facelift. But yeah, in general, these are the questions that patients ask me the most. Let's say, there's a word in English called concern. I'm trying to find a translation for it in Portuguese, but these are the main doubts, the main questions they have after surgery. And as you saw in the explanations, time is the master of reason, and the post-op period helps patients practice patience. You have to be a little patient. You have to wait a bit for things to settle down. Sometimes, because it really is a surgery on the face and patients are looking at their face every day, brushing their teeth, looking in the mirror, combing their hair, they end up noticing things more. And as they themselves tell me, right, they go out on the street and everyone ends up noticing and everyone has an opinion to give. So at this moment, it's important for patients to stay calm. Everything will settle into place, and haste is the enemy of perfection. Yeah, sometimes even we notice a few things. We want the surgery to progress faster, but one thing experience has taught me is that you have to have a bit of patience, both on the patient side and the doctor's. So I also practice my patience during the post-op period because sometimes I want to do some procedure to speed up the recovery, but I've realized that time ends up taking care of all those little post-op details. So yeah, time is essential for healing. This applies to facial surgery, body surgery, liposuction, really any type of surgery, actually. Guys, that's it for today. And next week, I'll bring another topic also related to facial surgeries and fat grafting. If anyone has suggestions for topics or questions, feel free to send them to me during the week. Big kiss. and see you next Monday.